Yeah, good afternoon, everyone, and thank you for the introduction there, Dr. Winkleman. So this session here, Living in the World of ASF, what I'm going to do generally is take you through step-by-step procedure, in a sense, of what would happen if you were in a farm in China and it happened to become positive with African swine fever and the outcome afterward. Before I get to exactly what cases of ASF in China, the one question people may have is why exactly might Pipestone be in China? And like many things in the industry, it all comes back to Bob. Bob had the opportunity to make it over to China many years ago. I believe it was with the U.S. Soy and Grains Council, and with that, Dr. Spronk came over shortly thereafter with Dr. Morrison, and since then, we had the opportunity to continue to go over there. So Dr. Morrison's legacy lives on. So looking at the current reality of the ASF situation in China, no one can truly estimate the population of sows in the country, but there's a general expectation that in the beginning of 2018 in August, there was somewhere in the neighborhood of 30 to 40 million sows. And over the course of the past 12 months, since last August, that number has decreased dramatically, with estimations today that somewhere in the neighborhood of minimally of 40% of those sows have been destroyed. So if we just think about that from a numerical perspective, in 12 months, somewhere greater than 12 to 15 million sows have been destroyed. And if we think about that, in 12 months, more than 2 times the entire U.S. sow population has been decreased. As a result, there have been many changes that have happened in the industry, especially just from a food security situation. All proteins in China, all animal proteins, whether we're talking about pork, chicken, goose, duck, beef, lamb, you name it, everything has increased dramatically in the last several months here. To put numbers to it, interestingly enough, the pork price in China has increased so much in the past 30 days. If we look at the current cash price here in the United States, I'm not sure what happened today with the markets, but if we think 47 cents as of last Friday, in the past 30 days, the cash price in China has increased over 70 cents on average. So if we think about that, in 30 days, the cash price has increased 150% of the entire live price value in the United States. So quite dramatic increases in overall price. And it's not necessarily one specific type of farm that has been affected from African swine fever. Farms of all different sizes, whether we're talking about backyard farms, traditional farms that might have dirt floors, partially slatted, infrastructure, all the way to what would be considered newer farms, or farms that we would all generally be going through in the United States, larger commercial farms. All these farms would be affected by the virus. So if I was to summarize the cases that I can comment on, it would be a total of 2 separate sow farms totaling 12,000 sows, a number of downstream sites, which would be, once again, newer infrastructure similar to what we would be used to, working in the United States, and then a significant number of contract finishers that would be associated with maybe some more poor biosecurity, dirt floors, partial slatted barns that may be more difficult to clean and disinfect. And there's been a lot of published information about African swine fever and what exactly you might expect to see in a herd population if it was to become infected. And if we were to compare that to other foreign animal diseases, this would be a slide from Deppner, but if we were to compare it to other foreign animal diseases, the contagiousness of African swine fever compared to others is not as great. However, the pathogenicity and the mortality that you would expect from the number of animals that would be infected is very high. So if we were to compare it to classical swine fever or foot and mouth disease, would generally not be transmitted as rapidly, but the level of mortality you would have from those animals that do get infected would be much higher. To put that in a different visual representation, if you were to look at these 3 different viruses once again, with African swine fever in the bottom left, transmitting slowly through a population, but once again, high mortality. And now this would be mostly published information, so I know the question that everyone has here and I had before going to China, experiencing any of these situations is this accurate? Are you really going to see somewhere in the neighborhood of 90+% mortality? Is this something that really happens? So to look at that, I'm going to go through two separate presentations, the first of which would be a crated gestation barn, so something similar to what we would be working with in the United States in many different enterprises. And then I'll be going into a nursery, which would be penned like we would have in majority of farms. So if we were to look at a crated sow farm, this would be a visual representation where each one of those blue boxes would be a individual crate, and the white rows would be a separation, either a feed alley or a manure alley. And this would be a break that happened, and over the course of about 2 weeks, this would be the representation movement in that population. Every single one of those boxes that would be red or white would be a sow that was found to be positive or euthanized to prevent further spread. But with that, after about 2 weeks, you can see, in stark contrast to what we would associate with a PRRS or a flu infection, it does not necessarily move through an entire barn, entire population at the rate at which we would be used to. Very much more slow transmission through a population. Generally, if they would be on the same trough or in the same water space, that would be concerning. Looking at that in a second example of a case in a crated gestation barn, this would be a similar representation with the blue boxes representing a number of different crates in a row, and in this situation as well would move down the line of gestation crates from one to the next, not necessarily once again moving through a population at a rapid rate. So to look at what exactly you would see in a crated gestation barn, without a doubt, you're going to have sows that would be in the same trough section or neighboring sows. Most likely, if they do have a fever, they have an abortion, or they're off feed, they're going to succumb to that disease within 24 to 48 hours, and they're going to end up passing away. If you do have this break in a farm, it's going to be very difficult to stop. There's no treatment you can use to prevent further spread, and there's nothing that you can use to decrease the mortality rate that you may expect to see. So then that would come to, if you did have a break in a barn, what would be your next step? Well, you'd have to depopulate that farm in some form, and whether that would be moving those pigs to market, understanding that China is a very different culture and situation that we would have traditionally here in the United States, might be the opportunity to ship to market. Secondarily, there'd be a mass euthanasia opportunity, and in those situations, generally turning off the ventilation would be the most effective route in order to accomplish that, especially given the fact that in China, firearms or captive bolt guns would be illegal and not an available option. After euthanizing or having those animals be deceased, then disposal would generally be accomplished through a method of burial. And then the last thing I have on here would be tooth extraction. And once again, given the fact that it's a different culture and completely different world from what we might be accustomed to here in the United States, tooth extraction would be a term that would be described as a methodology to prevent the further spread of infection from one sow to the next, and overall essentially try to decrease the spread and prevent new infections in the barn. So there'd be a number of people trying to practice this and execute this throughout the country, where if there was a barn that was proven to be effective in a sow farm, they would attempt euthanizing sows that would be neighboring affected sows, in addition to sampling any animal that would be off feed or have a fever, subsequently isolating staff to specific areas to ensure that they are not going to potentially promote the spread, and then also anything that would be a vector like movement in a water trough, trying to prevent that spread as much as possible. Is this effective? To date, there are a number of producers that may be trying this methodology in China. Is it effective? To date, remains to be determined. There may be people that have success for a period of time, but for how long that can be, that remains to be seen. So then if you had a known positive farm, how could you diagnose that? One, either through serum samples or samples to find African swine fever nucleic acid, or if you had animals that end up actually succumbing to the virus and passed away, you perform necropsies. The finding you would tend to find more likely than not would be an overly enlarged spleen. And looking at necropsies, if you had a spleen that would be at least double the size of the liver, that would be a very concerning finding. Are you going to see this in every single case of African swine fever? No, you are not. But if you were to find this, I would definitely be concerned, along with increase in mortality, fever, and a number of sows that would be off feed. So that would be what we would expect to see in a crated sow farm. Now, if we were to move to what would be a nursery grow finish setting, what exactly might you expect to see there? So this would be a commercial barn that, from my perspective, would have pretty good biosecurity, would have a wall surrounding the entire complex. Following that, in order for personnel to enter and exit that site, there would be a guard that would be watching any sort of movement. At that point, there would also be a shower for those people entering that site. Subsequently, the staff would stay on that site for a minimum of 21 days and generally about 2 months today. So they would be on site, not leaving. No one's going to come in and leave, and they're going to stay working in that enterprise for about 2 months. Then to actually move into the farm, there would be a subsequent shower, so a number of biosecurity protocols to prevent anything entering. And then there would be 8 different rooms in this site that would house pigs, total of 20,000 animals on this site. And what we encountered was an increase in mortality in one of these rooms. And over the course of several days, we had a continued increase in mortality that did not respond to treatment, whether we look at antimicrobials in the water or anti-inflammatories in the water. To put numbers to this, over the course of 19 days in this nursery, where there was pens and nose-to-nose contact throughout the facility, ended up with 96% mortality in 19 days. So is this a real situation? Will you actually encounter 90 to 100% mortality with ASF? Yes, you will. And the most alarming part about this is if you look at that trend over the course of the first 10 days from which you may have a diagnosis, the mortality rate isn't necessarily going to be increasing that dramatically. But then after 10 to 14 days, that number will increase at a dramatic rate, with that number really not really stopping until the total population is dramatically decreased. So now you have had a farm that has been infected. You understand that you need to create a depopulation protocol, and afterwards you're looking at the next step, which would be bringing animals back into that site. So what exactly are you going to do, and how would people today be trying to clean up these sites that may have had African swine fever? So outlining these steps, very thorough. Do we need to do all of these things? I can't necessarily comment 100%, but I can tell you what we have done has proven effective. So if we're going to look at the detailed outline of all these different things, the first thing you'd like to do after depopulation is looking at any potential equipment or any item that could harbor the virus or be contaminated, removing that item from the area. So whether that's animal health products that may have had a needle inserted, whether that's any food from the kitchen, because all the food that would be consumed on site by these staff is generally cooked on site as well, removing that as a potential risk or vector, removing all that from the premises. Any wood surfaces such as furniture or even infrastructure that would be part of the barn, trying to cover that up as much as possible would be beneficial. Clothes that may have been worn on the farm would also generally be removed. After that, considering that this virus is shed in all bodily fluids, with manure being a large risk, scraping the majority of that manure into the pit would be something you'd want to do first. Subsequently after that, there's been research conducted to say that African swine fever will survive for no longer than 14 days in a slurry pit. With that, after 14 days, would like to drain that pit, given the fact that also in China, almost 100% of the manure management systems would be a lagoon-based system. So draining all of that manure into a pit would be or draining all that manure from the pit into the lagoon would be the next step. After that, you would start your pressure wash and disinfection protocol, which would be rotating disinfectants as well. First, want to pressure wash and try to get rid of the vast majority of organic material. And then after that, disinfect. Virkon, Synergize, and bleach would be the things that we would look at as effective against African swine fever. And then after, especially in nurseries and finishers, after that first round of pressure washing and disinfection, removing all the feeders and all the gates to allow yourself to decontaminate the nooks and crannies of those as much as possible would be the next step. Second, pressure washing and disinfecting 2 more times, rotating disinfectants again would be the next step, making sure you're getting every single area. After that, considering that you may be harboring small amounts of manure in between the cracks of the slats, you would then go through and use essentially a flamethrower to disinfect the insides of all those slats. Subsequently, you'd want to make sure that other areas that may be harboring the virus, including water and water lines, the compost, and even the tractor that would be used to move out those carcasses would be fully cleaned and disinfected as well. Some extremes, if you were moving up and down a dirt road, which would be difficult to disinfect, some people have even taken the approach of trying to burn that road to disinfect it in some sense. So then after pressure washing and disinfecting 3 times and removing all of the gates and all the feeders out of the entire facility, then you would want to whitewash the barn, understanding that this is going to be effective at killing ASF as well. Throughout this entire process, you'd want to be sure to be auditing the procedure and ensure that there is no organic material remaining anywhere on site, and if any organic material was found, for sure would want to test and subsequently wash and disinfect again. After that point, where you had the confirmed negative from all the sampling, then you would want to be sure to put everything back together and test again. If you found any positives, once again, you would want to wash and disinfect again. Then, moving in sentinels to act as a bioassay to confirm that the site is negative would be highly recommended. And generally bringing in somewhere of a population of 5 to 10% would be the next step. And looking at the age of animals that infrastructure can contain, whether that's nursery animals for a nursery site or larger animals for a finishing site or a sow farm would be recommended. So then the question is, how many times has this protocol been executed and what would be the success rate total? As of today, we have executed this protocol successfully on 1 sow farm and 4 downstream sites with a number of others in the completion process with sentinels in the farm. And we have not had any re-breaks after animals or sentinels have been entered into these sites. So with that, I feel that we have confidence in this protocol and in this system. Is it extreme? Yes. Does it take a significant amount of time? Yes. The fastest that it appears to be executed from start to finish depopulation to bring in new animals would be a minimum of 3 months. And I understand Dr. Millionaire is going to be talking and reviewing the Russian perspective after myself. With that, I understand Russia has some different protocols from 6 to 12 months requirement, and even removing the slats and pressure washing the pit. Is that necessary? Not necessarily something that we have found to be a requirement to date. So summarizing here, comparing an ASF outbreak in a crated sow farm to a nursery or a finisher is going to be a very different situation. It's going to transmit at a different rate in each one of those sites, but after there would be entry into that site, it's going to be difficult to control. The biggest thing that you can do would be to prevent it. Like the majority of viruses, an ounce of prevention is worth a pound of cure, so everything we can do to prevent it is going to, without a doubt, provide value, especially looking at the current market prices in China. Every weaned pig is going to provide substantial opportunity for profitability. If a site was to become infected, the decontamination procedure that you'd want to practice would be very thorough to ensure that you're not going to have that site re-break and become infected again. And the risk is present 100% of the time. If we think back on 2014 when PED came into the United States and it ravaged through the majority of herds, producers were very concerned about anyone entering any site at any time point, and in China with ASF, I would consider this to be PED on steroids. So anything that would potentially be a risk, people are very concerned about ASF entering any herd in China. At this point, I'd be happy to take any questions on the China situation with ASF.
Any quick questions for Joseph? Yes, sir. Is there Mike's there?
Thank you for your presentation. And I'm sure those biosecurity protocols are well abide by, like commercial farms and stuff like that. But in China, like 65% of like farms are backyard farms. And I just wonder how applicable or how cooperative are those backyard farmers to these biosecurity protocols to prevent further spread.
Yeah, so the question would be related to the ability of backyard farmers to implement biosecurity protocols to prevent African swine fever from entering their herds. And without a doubt, in order to have the biosecurity protocols and infrastructure in place, it's an expense that needs to be acted on. And backyard producers that may not necessarily have those funds would, without a doubt, be at somewhat of a loss compared to people that may have more equity to put these protocols in place. Agreed.
Joseph, what is the risk of feed contamination, and are you doing anything about it?
Yeah, no, that's a great question, and I think the session tomorrow about feed risk and transboundary disease is going to be valuable to attend, without a doubt. Would I consider that to be a risk? Without a doubt, and looking at the infections that we've had in our herds based on the biosecurity protocols that we have in place, I would put feed transmission at the top of the list for potential source of infection, route of infection. So with that, ensuring that we have the proper biosecurity procedures from a feed perspective, whether that's understanding that the mill has proper protocols or making sure that the protocols at the farm, especially from a transportation side, would be executed properly, would be of utmost importance.
And do you have mitigants in the feed, in all feedstuffs?
Yeah, the question would be is, would mitigants be used in the feed? Understanding the value of feed mitigation on a number of different products, utilizing feed mitigants would be something we'd be looking into.
Any other questions? Yes, sir.
I was wondering, what is your experience with other routes of infections like insects or water, drinking water? It seems to be more and more in the picture.
Yeah, no, the entry of the virus into commercial farms is a highly debated topic, and whether that's flies, whether that's water, whether that's feed is something that many people are looking at, and trying to decrease the insect population to decrease that risk, or having some sort of protocol for water would definitely be things that many producers are looking at.